thesis work, I'm working with Dr. Sunil Khanna, who is the professor that oversaw the program I did this summer, the Botswana Global Health Initiative. And I'm just focusing on assessing the attitudes of a community in Monotala, Botswana, which is a rural village, just assessing their attitudes towards certain sexual and reproductive health and gender-based violence topics. And for that, we were partnering with a school with children around ages 12 to 17, and we just kind of got feedback on both the general attitudes and beliefs towards sexual and reproductive health and gender-based violence topics, and also just on how we structured the program, if it was culturally relevant. So the goal is for us to eventually pull our involvement from a specific community and allow it to kind of self-propagate, which I think is a really important model to shift towards. It was my first experience with international work also, which was really wonderful. Just kind of getting to move outside my bubble more and interact with communities that have different experiences, different cultural backgrounds than myself. It kind of reaffirmed my desire to go into a health-related field and to support populations that may not have access to resources or the kind of support that they need. And just having the opportunity to kind of get that more hands-on experience is really valuable in affirming the demographic that I want to work with.